Welcome to Fit Families TV for part 3 of our interview with Ashley, our college student. Before I start talking to her, I'd like to explain to you what I think is a critically important issue related to the abuse of ADHD medications. And that issue is that the line between therapeutic use and misuse of ADHD drugs is very tricky to figure out. Part of the problem is that we have professional people prescribing these medications, and it seems to make it for people generally to think that, well, these drugs must be okay. And as a result, they underestimate how serious these drugs are. To highlight how serious these medications are, in 2004 there were 8,000 emergency room visits related to the abuse of ADHD medications. These drugs are more serious than people think, which is why you have to have a professional physician, monitor the use of these drugs. So Ashley, with that in mind, do you think that college students differentiate between the use and abuse of ADHD drugs?
Not at all. From my experience of talking to people and just what their ideas are, I really don't think that they do. They don't see that there really is a distinct line between whether you're supposed to be taking these medications because you have a diagnosed problem, and it's okay to take it because it's like a study helper. They don't even think it's a study drug, you know. So I think that there's definitely a problem there of distinction.
Do you think that college students put ADHD medications on a continuum with energy drinks and caffeine?
I think that they're in the same, I guess, area on some sort of a spectrum. I think that energy drinks or like coffee, like caffeinated things, those are seen as a little bit less like serious, but I really don't think that there's too much of a differentiation between the two.
Ashley, do you think that ADHD drugs appeal to a different type of student on college campuses than other drugs might?
I kind of think so, because ADHD, if the student is using it for as a recreational drug, it depends on the purpose of the use. So if they're using it as a recreational thing, like to go out and party with it, then no, I think that it appeals to students that would use smoke or marijuana or abuse alcohol. But I think if it's a student that views it as a study tool, it's more likely to attract students that really are, academically sound and strong students that might not really abuse other drugs or alcohol even at all, if some maybe not even at all. But I think it really depends on the way that the student views the use of it and what their purpose of use is.
So Ashley, do you think that the lack of awareness of the difference between ADHD drugs and these other drugs is a big deal on college campuses?
It's a huge deal because students and parents don't have any idea, because it's not really publicized. It's not something that you really hear about at all unless you're really digging for information, that there are some huge health risks and legal violations with the use and abuse of it.
Thanks, Ashley. Next week we're going to have our final interview on the misuse of ADHD drugs. Thanks for watching Fit Families TV.